Hello, how are you doing? My name is Violet Mbiti and I'm a trained budget facilitator by International Budget Partnership Kenya and Uraia Trust. Thanks for joining me once again as you seek to understand and analyze key budget documents. So, before we go there, as we had stated last week, that this week we are going to talk about, we are going to discuss further now like functions with regard to sectors. So today we are going to talk about the health sector. All right. So what is the function of the national government? And what is the function of the county government? So with regard now, let's say like Kenyatta National Hospital, which is a referral facility. Who is in charge of it? Okay, so if money is sent by the treasury, so who should it be sent to? To the county or to the national government? Know that there are two arms of the government. There is the national government and there is the county government. So referral health facilities like Kenyatta National Hospital, that one is under the national government. And also health policy, development of health policy, that is the mandate of the national government. So now this begs the question, so what is the function of the county government as outlined in the 2010 Constitution, 4th schedule, especially with regard to the health sector? So you see, like the way like in your community where you live, you know, like there are refuse dumps, all right? The like garbage. So the county government, your county government, that is its responsibility when it comes now to the health sector, to ensure that where you stay, it is clean, okay? The other thing is water and sanitation services. Those are the functions of the county government. So what about funeral parlors, all right, or crematorium, okay? Like, you know, like the Kariako crematorium that is in Nairobi County, okay? So like funeral parlors, who is in charge? That is the function of the county government. What about ambulance services? That is the function of the county government. That is why you saw the other day that Machakos County procured so many ambulances, okay? And you can see that various counties also have many, they have several ambulances. The other thing you should also know is that anything to do now with the primary health care, promotion of primary health care, that is the function of the county government. But as I told you earlier, last week, I mentioned that, you know, there are certain functions that were not outlined in the 4th schedule. And at that time, I had mentioned that if a function is not clear, okay, that is now when now the transition authority through its legal notice now made it clear. So like for example, like the immunization, the transition authority through its legal notice stated that now the immunization is a function of the county government, all right, under primary health care, all right. The other thing I would also like to mention is with regards now to drugs, okay, procurement of drugs. Now the KEMSA Act 2013 states that the state corporation, okay, which is KEMSA, shall procure drugs and partner with county governments to ensure that the get these drugs. So the process that usually happens is that there is usually procurement, there is warehousing, all right, and then there is distribution of these drugs, medicines, and medicinal supplies. So that one, the act about procurement of drugs, it wasn't outlined in the fourth schedule, but now through an act of parliament, now the role regarding now procurement of drugs was made clear through KEMSA Act 2013. All right. Now, with regard now to hospitals, okay, provincial hospitals. Now, who is supposed now to manage that? You know, like when in 2013, now when now counties now started now their first term, all right. The fourth schedule hadn't outlined like who is responsible now for the provincial hospitals, all right. But now, the Health Act 2017 made it clear. It stated that level 1 to level 5 hospitals, those ones are under the county government, okay? And level 6 hospitals, they are under the national government. And it also stated that each county should have a level 5 hospital, all right? So let me ask you, as a citizen, which level 5 hospital is in your county? You know, the act stated that these hospitals should have adequate facilities. And these adequate facilities can only be found at the level 5 hospitals in a county. All right? That is why you found that that is why you find that level 5 hospitals, they require lots of health personnel. They also require equipment, and they also require the personnel, the staff, to understand even how to use this equipment, okay? And there are a number of level 5 hospitals. You see, like in Nairobi, there is Mama Lucy Kibaki Hospital, all right? In Machakos, there is Machakos level 5 hospital. In your county, what's the level 5 hospital there? The other thing you should also notice that if the fourth schedule didn't make some clarifications clear, the Transition Authority legal notice expounded further on it. And if it wasn't clear, now the National Assembly, people had to take it to court so that courts can make decisions, or take it to the National Assembly. So when they are taken to the National Assembly, now that is when now the Health Act 2017 outlined the functions of the national government and the county government. Like, for example, like the national governments are supposed to develop health policies in consultation with county governments. The county governments, on the other hand, they are supposed to implement now those particular health policies, all right? And then also the Senate also put forth the Reproductive Health Bill 2014, so that it can now say, like, they say that the maternal and newborn health facilities should be adequate, meaning they should have adequate staff, they should have adequate facilities, they should have adequate even drugs, all right? So you can see now the importance of these acts of parliament. So I want to say thank you for joining me as we discuss today now regarding the health sector. And we are going to go next and talk about another sector, but that one we'll do it next week. So thanks for joining us once again, and if you have any question, kindly ask in the comment section on this channel. If you've liked this video, click the like button. If you haven't yet subscribed to this channel, do subscribe and click on the notification button so that you can be updated when now we upload new videos. Alright? So next time we're going to talk about now functions with regard to the water sector. Thanks for joining me, and I hope you are now understanding how function works. But for you to get to understand further, kindly obtain a copy of the Constitution and go to the 4th schedule so that now you can understand clearly what are the functions of the national government and what are the functions of the county government. Thanks for joining me. See you next time.